much for that information. Wonderful. Okay. So those on YouTube, did I just say Facebook? If you just joined in on on YouTube, it's great having you here. You're welcome. This is Josephine Greatness on Josephine Greatness TV, and today we are on live again. And today is not about relocation and migration. Today is a health education session. So I started a series, a health education series on TikTok, and titled Your Midwife Series. And this is the second live session I'm having on the Your Midwife series. The first live session was on blood groups and rhesus factors, how it affects your life, how it affects um, your health care management, etc., etc. So please, when you check on my playlist portfolio, you can go into the health education playlist, guys, you on YouTube, and you can have it. Those on TikTok as well. When you go onto my TikTok bio, you are going to find my YouTube channel link there. Click on it, and you find the blood group and rhesus factor live session replay there. It's available in the health education playlist. All right. So, yeah, today that's what we are going to be talking about. And I've got here in the guest seat with me Dr. Hans, who is going to discuss the topic with me. Today, we are going to be talking about genotypes, sickle cell disease, and how it correlates with choosing a life partner. So if you are an adult, because choosing a life partner is adult's thing, you know. So if you are on the road to choosing a life partner, or even if you are already married, if you are a healthcare professional, or you know anybody who this particular topic, genotype, sickle cell, choosing a life partner based on these is something that they are looking for, or they've got, you know, high volumes of questions about it, or myths, they are confused about some myths and sayings that they've heard around in the community, please make sure you are sharing this live with them. And if you haven't yet subscribed to this channel on YouTube, make sure you are clicking on the subscription button, and you are turning on your notifications so that you don't miss any of my videos or live sessions. All right. It is Josephine Greatness, your midwife on TikTok, and Josephine Greatness on Josephine Greatness TV. So I'm joined here with me, Dr. Hans. As I've said once again, and Dr. Hans, thank you so much for joining us. And you know, I'm very glad that you made it. If you are here right now, I'm sincerely glad that you made it for today's live session. We are going to be talking about a very important topic that affects health, that affects marriage and family planning, and that is sickle cell, genotype, and choosing a life partner. Now, many people have heard about terms like the AA, the AS, SS, SC, or AC, but not everyone understands what they really mean or how they can affect, you know, their future children. That's why today we are joined by a medical doctor who will help us break it all down, from the basics of genotypes to the health challenges of sickle cell disease, and finally, how couples can make informed decisions when it comes to relationships and marriages. So stay with us. Stay with us. Ask your questions in the comment section, and let's get started by first asking Dr. Hans to briefly introduce himself to us. Dr. Hans, over to you.
Right. Thank you. Greeting to everyone listening. I'm sure there will be some hard personnel there, so we're going to make it like a sharing, a discussion kind of a thing.
Yeah. So, Dr. Hans, can you please tell us a little bit about yourself?
Yeah, actually, Dr. Mbu Hans, based in Cameroon. That's where I practice.
Wonderful.
Yes, I practice as a general practitioner. I've been working for 4 years.
That's amazing.
And actually, I saw the topic is really interesting when you brought it up. So that's why I really also appreciate you, and it's good to share information, and people should be sensitized. This is a topic that's, especially in Africa,
yes,
people don't know much about it, and it really affects the population.
Yeah. You are right. People don't know much about it, and even those who know a little bit about it still don't really see how important it is. This topic is. So thank you so much for making time to discuss it. So Dr. Hans, let's move straight into my questions for discussion today. So, guys, if you just joined in, George, I can see you. All those who just joined in, both on YouTube, on TikTok, you are most welcome. Today, the topic on board is what you see on the screen on TikTok, and what you see as a description. The title on YouTube is sickle cell, genotype, and marriage. All right. So please keep liking the live, keep tapping on your screens on TikTok, and keep sharing the live to people so people can join in to get this nuggets that we are going to be discussing. So, Dr. Hans, what does genotype mean, and why is it important?
Okay, genotype, like it names, is actually a genetic information which is coded from the cells. The cell is a functional unit of human body, which maybe most of us in secondary school have known about that. The nucleus of the cell codes information like scent that the body should manufacture something, you understand?
Mm-hmm.
So it's like information that is coded, and from that information, when it concerns birth, reproduction, that's where human body will come from. So that's the basic and simple understanding
Of what
the basic information for human life.
Okay, so can you please explain the common genotypes, the common types of genotypes you've got?
Okay, there are over 1,000 genotypes that have been discovered, but there are some that are more frequent and concern humans. For example, the ones I mentioned recently, the pathologic one like the sickle cell, the carriers, which we call them sickle cell traits, and those that are really normal. The sickle cell one, we call it SS. The trait, we call them AS, and the normal one is AA, which actually play a role when it comes to getting married, giving birth to children.
Wonderful. Wonderful. So you mentioned there are high volumes of genotypes that have been discovered. And you've mentioned the AS, you've mentioned the AA, and then the SS. What about AC or SC?
Like I mentioned, actually, those are the most common. AC too will likely follow, because AC has their own role to play, because when it combines with someone who is AS, actually they have a risk of having a child who will be a sickler. So it's also considering, I just mentioned the most common ones that people will hear about, you understand. Also there is E genotype, there's AE, AD, and others, which are less likely to be pathologic or causing harm.
Wonderful. Great. So, how does someone inherit their genotype from their parents?
Okay. It is something that's autosomic recessive. That means if you carry it, only one gene of it, actually there are two. One is S, and S, they can manifest. So when I mean manifest, it means it is the person would present with the symptoms that we see in sickle cell patients, right? Since it is autosomic recessive, like I said, if you are a carrier, that's your AS, you will not present with the symptoms. But there are conditions, there are certain situations where an AS, that is a sickle cell trait carrier, who is not actually sick. There are some situations where they can present with pathologies or some things that affect them in life. So let me just give a few, so that if someone does his genotype, if you do the test electrophoresis and they say you are AS, you should know, or even a family member should let them know that if you are AS, you can witness any of these things. Right? So, talking about the sickle cell trait, those who are not sick, they can have, for example, if you go to high altitude, because the sickle cell gene makes in a way that the hemoglobin in red blood cells, which are supposed to carry oxygen around the body, their own doesn't circulate normally. Okay. So it's a kind of it's a banana shape than being the normal or oval shape that we know for red blood cells.
So which genotype are you talking about? Is it the AS in general, or the okay? Because
I'm talking about
the traits and the disease.
Now.
Okay, the disease itself. Okay.
Yeah, I'm just trying to give a brief description of how the disease is to manifest.
Okay.
Right. Though the sickle cell traits, the carriers, they don't have that. There are situations where they might find themselves and they manifest actually some of the symptoms. And their own can be risky and dangerous because they are not known as sicklers. Okay. They might not know that they are sick, and it might just surprise them. For example, if you are traveling high altitude, you know, the higher you go, you have less oxygen.
Oxygen, yeah.
Okay. Yeah, you might have some symptoms. Rhabdomyolysis, sudden death. There are some rare cases. They are quite rare, but they do happen. There is, with the sickle cell, there is risk of being dehydrated. That's less water in your body, because the kidney does not reabsorb the water normally. All right. This can happen with sickle cell carriers, the sickle cell traits. So we call it nephrostenuria. Nephrostenuria. Our kidney normally, when we drink water, it enters the body, circulating in the blood. When it reaches a level of the kidney, through the kidney nephron, which is the functional unit, it needs to reabsorb some of the water. That's why the water is balanced in our system. But for them, they have a tendency of having less water because their kidney doesn't filter the water normally. So there's this nephrostenuria, rhabdomyolysis. That's the hemoglobin. This is not functioning well. You know, when we talk of rhabdomyolysis, we mean muscles, a kind of muscles being stressed, you know. And when this one of rhabdomyolysis mostly happen with people who are doing some kind of exercise, let's say athletics that are training for a particular sport, and they are unaware. Most often, there are people who are unaware of their situation. But those who are really informed, when you're already informed, you won't go into certain activities. Okay. And actually, concerning this, there are in developed countries like UK and others, there are genetic counselors. You understand? There are genetic counselors who take into consideration all of this. There are also doctors who are specialized in genetics. They give counseling and stuff like that. But in Africa, we are still struggling with that. So, continuing with that, there's also, I already said, there's risks of crisis. You know, when we say crisis, these sickle cell patients, they used to have feel pain most of the time. Like, they just get up, they fall sick frequently. They complain of pains on their joint, right? Can be on the joints, can be anywhere in the body. Sometimes at the chest, call it acute chest syndrome. That's due to the blockage of the blood vessels by those abnormal hemoglobin that they are having. And the spleen, they have what we call, most of them develop functional asplenia. That means the spleen, which is that organ that filters and kills red blood cell, when their half-life have ended, you know, lifetime of a red blood cell is about 3 months, 120 days or so. So normally when that time reaches, the spleen have to break them down. And for them, their spleen is constantly breaking down most of the red blood cells because they see them to be like abnormal, pathologic. So the spleen becomes larger as an abnormal side, and it doesn't function normally. So they call it functional asplenism. It's mostly happen with the sicklers, but it's also common with those who are sickle cell carriers, the traits. There's also a slightly increased risk increased risk of thromboembolic diseases, especially for female. When you're a woman, mostly those who are on contraceptive. First of all, it is well known, documented that contraceptives has a high risk of developing thromboembolic disease. That means it can make abnormal coagulation in your blood and can give you something like stroke, heart attack, and other things. So those are the common things that we can find with people who are sickle cell trait carriers.
Okay, wonderful. So, in summary, you've just taken us through signs and symptoms of the sickle cell disease itself. And you've mentioned that some of these signs and symptoms, those who don't have the disease but are just carriers as a trait, can exhibit some of these signs and symptoms. Wonderful. So, just so that we are, if somebody just joined in, can you please differentiate between the sickle cell trait and the sickle cell disease? So before you go on there, somebody may have just joined in, and just to let them know, there are some common types of, the genotypes, and these are the AA, the AS, SS, and AC. So the AA is the normal blood. It has no sickle cell trait in it. Then AS is a sickle cell trait. That is, the person is a carrier. Usually they are healthy, but they can pass the S gene to their children because they've got, as Dr. Hans already mentioned, it's two genes. So if it's AS, that means that you have one A and then one S. And it's possible that even though you are living a healthy life, you are a carrier, you can still pass that S onto a child. And then the SS is the sickle cell disease itself, which people who are SS have severe or serious health conditions. And then the AC is a mild carrier type, and it may cause issues if they marry or they are combined. They have children with somebody who has got an S in their genotypes. So, Dr. Hans has taken us through some of the signs and symptoms that people with the sickle cell disease itself exhibit. And I'm just asking him to differentiate between the two carriers, that's the AS or AC, and then those who are having the sickle cell disease itself, the SS. Dr. Hans.
Okay, well, like you mentioned, the SS is the sickle cell patient, and the AS, those are the carriers, those who do not manifest the symptom. But at certain points in life, like you mentioned, high altitudes, they can develop some of those symptoms. And for their own, it's dangerous because it can take them by surprise, right?
Yeah.
So, we have explained clearly, AS is the sickle cell trait, that is a carrier. SS is a sickle cell, and AA is a normal stuff. I don't remember the question exactly.
So I was asking the difference between SS and AS.
Actually, SS, S stands for sickle cell genotype, if you put it that way. S stands for the sickle cell. Since we said it is autosomic recessive, it means if it is alone, it cannot manifest. So,
okay.
If it's only one S, it doesn't manifest the disease.
Wonderful.
When it's two S, so if the mother is AS, the father is AS as well, there are 50% chances that the children will be AS. There's 25% chances that the children will be SS, and 25% chances that the children will be AA, normal, not so. Because if you do genetic crossing, you see that out of 4 children, 1 can be SS, 1 can be AA, 2 can be AS, right? So from there, although that's just to illustrate, we just use that for illustration, but in life, in real life, you might have the chance that you only be giving birth to children who are AS, AA, they will never fall sick. But some couples are really unfortunate that most of their children out of 3, you see 2 that are sick, meaning the SS is manifesting most often. That is why counseling, giving information, and in fact being informed, that's the basics. Especially in Africa, we are very less informed when it comes to health situations. And it's difficult to counsel persons, especially adolescents, when they are like they're falling in love. I want to marry this person. Even adults, you say you love this person, you want to marry the person, or you go and do some tests in the hospital. They say no, you people can't get married because some people say no matter what they want to go on, and it is quite challenging for the family when you have a sickle cell child who is manifesting the disease frequently. Almost every 3 months you're in the hospital for those. Some even come, there are moments that some come almost every month, you see. It is stressful, it's draining financially, psychologically, and those people, they need a lot of psychological support. So it is very important that somebody, at least, you should know you are on. Try to help your family members know they are on, right? If you are there was in the whole world, the highest population is AS, and people are not aware. People mostly discover either they are going for premarital counseling, or they just went for maybe some checkups in the hospital. That's something that, if people are well informed, they go for it. Even you are supposed to know your own before when you meet somebody, maybe before you go far, first of all, do that one. You'll be helpful to people.
Okay, so Dr. Hans, you are telling us that if we meet somebody and, in the knowing me, knowing you stage, what's your name? Where do you come from? We should add what is your genotype to it. Is that what you're saying?
It will be difficult. When you ask that to somebody, the person will be like, "What?" It's like you're challenging the person. Some people, when they don't know, they might not take it normal. They'll be like, "Are you trying to show me that you know so much of genotype or what?" So it's like when you're getting used to the person, right? You say, "You see, I checked my genotype. They said I was this. Have you had the opportunity to check your own, or can you? You see, you can present it that way. You understand?" Not that you say what's your name, what's your genotype. If it does not match, you just say bye-bye. No, not like
that. Okay. So with this, I'll ask again. Maybe somebody is here. The person is AA. For them, they don't have any traits. They don't carry any of the sickle cell gene. For them, they can marry anybody, right?
Of course, AA has no problem. But if you marry SS, just know that all your children will be AS, and they are already carriers. So you just start telling them not to marry another SS like them.
Wonderful.
Right.
So what happens if 2 carriers marry? I think you've mentioned that already. You've mentioned 25% are going to be AA, 50% AS, and 25% SS.
Exactly.
Wonderful. So, can couples with risky genotypes, like those who are carrying the disease itself and those who are just having the trait, still have healthy children? Let's say, for example, somebody is here, they are married already. They go to the hospital after this live session, they go in to check, and they find out they are both AS, or one of them is AS, the other person is SS. Can they still have healthy children?
You mean AS marrying SS, right?
Yeah, or 2 traits. Is it possible? Let's take the 25% AA. So let's say, for example, 2 people are both carriers, AS. Yeah. And it's possible that they may have 20%, 25% SS, and then 50% AS, right? Now, is it possible that they can have children who do not have the SS? Or then the second question too is, they find out that one of them is a sickle cell, is SS, and the other is AS. Can they still have healthy children? And if yes, what do they do to get healthy children?
Okay, I think that's actually 2 questions in one. The first situation is one we explained, talking about those who are AS getting married. That's why we talk of 25, 50%. Now, SS getting married to AS. There's no chance having a child who is AA. That's normal, right? There will be a 25% chance having a child who is AS. Yeah. Right. And the rest, 75% SS. So, although you have a chance of having children who are carriers, not sick, but the highest percentage, like I've said, 75% will be SS, because there's only one A there, which will cover 25%. Although in some lucky persons, that is why it is defined genetically through genetic calculations. But nature, if it's that when you are going to, when the genes are meeting, if it's a SS that comes up all the time that you're meeting, then you have the chance of not having a sickle. You'll be having AS all the time. But there's no way you have AA, because the mother did not have A, or the father, only one person had AA. Also.
Wonderful. So I've got here too that there are medical options. Can we talk about medical options like IVF with genetic screening? How that can help people who already find themselves? There may be some people who say that I can't leave this person. I love the person. I want to be with the person. Can IVF help them? And genetic testing?
This is something that is in blood also. It's something that is in the blood, no matter what you do. The only thing that you do, there are several tests that you do. There are some genetic tests that you do. Some people do DNA tests, which is non-invasive. There are 2 invasive tests that you do. We have amniocentesis. Yeah. That's it. They take a sample of the amniotic fluid in the womb, and they try to determine the genotype. There's also chorionic villus sampling. This one, they take a sample of the placenta, they examine as well. All of this is just to know, is the child SS? It will help the parents. If they discover it early, there's a chance that they can clear it off to avoid the suffering and all the like. It is not to make it somebody or the couple not to have an SS. The thing is, in the gene, your gene is encrypted in your gene. There's no way they're going to do this test to take it out. The test can only help us to know, is this child AS or SS or AA, right? Except you will want to do AVF, you take sperm from somebody else to come and fertilize your wife's womb or something like that. You understand? But if you really want to have your own blood, using your own gene and all the like, it will not change anything. It can only help us to know, is my child SS, is my child this, and then you take a decision. The earlier they do it, the better. Because once they are giving birth to the child, you cannot kill the child, right? That would be murder. So I think that's why those tests are there. It's not actually to rule out the pathology that's already within you.
Okay. And when you say these tests are there to help you make a decision, that means just like genetic anomalies, where some children have serious anomalies, and so they may ask you if you want to continue with the pregnancy or not. Does that mean that this option is also given to people after they've gone through the amniocentesis or the chorionic villus sampling? Are they given that option to decide?
It should be, because actually there's what we call, in some countries like ours, where abortion is not legalized, there's what we call medical termination of abortion, which is in medical practice. You know that doing abortion is for a reason, a medical reason, right? Yeah. So in other countries where abortion is legalized, they can do it at any moment. But some countries, they have restriction. There are some terms that when it has crossed, it has reached a certain level, Actually, the abortion is not legal. So there's always a window period where the couples are advised they can go for this test at this moment. Is it chorionic villi or the other one? So I think the main answer is that we don't do a test to rule out that stuff which is encrypted in your blood, but just to help us have more knowledge about it and make a decision.
Okay. Okay. I can see some questions popping up on the in the comment section. We will come to that. If you just joined in, please you are welcome. You can pop your questions in the comment section. So Dr. Hans, somebody is asking here, please can a sickle cell patient with SS. So a sickle cell patient is SS, all right. Can they travel outside their home countries? That's abroad.
Of course. I've never heard that they are restricting someone to travel because of sickle cell. I know most countries, they don't want you to come to their country with tuberculosis, with HIV, things like that. Even when they diagnose you with tuberculosis, that you have to travel. They always ask for chest X-ray, things like that. When you're going for immigration stuff, they advise you to take the treatment. Tuberculosis treatment is 6 months. After the treatment, you go and make a test. If it's negative, you can travel. But for sickle cell, it's a natural condition. I've never heard that they're restricting someone from traveling with that. So, like I said, there's this risk of when you're in high altitude, traveling in the plane, in the cabin, there are situations where oxygen concentration is low, which is risky for a sickler. So you need to be aware of all of that. There are some measures that they used to take. Understand? They can actually travel, but they need to be equipped. They need to be prepared. I'm sure all of that also go with finance. You need to also be aware financially.
So let's move on to family planning and pregnancy. How does sickle cell affect pregnancy and newborn care?
Of course, that is very important. Now, family planning first, like we said. Remember, I mentioned that contraceptives, which is the main part of family planning, because there are natural methods, there are hormonal methods. So, contraceptives themselves, they have their own risks. Like you have the risk of developing thromboembolic pathologies like heart attack, stroke, which can happen anytime. Plus the sickle cell traits, which come and add to it. Now, when a baby is delivered, that's already declared sickler, that's the SS gene. Also, there are things that we expect that the mother or the parents should start following up. From the beginning, from the first 6 months, the child might not really manifest because the child is having what we call the fetal hemoglobin, which starts disappearing from 6 months till 1 year, right? The fetal hemoglobin has the capacity to hold more oxygen than the normal adult hemoglobin.
Yeah.
So the babies less than 6 months, they don't really manifest. It's after 6 months when the hemoglobin starts switching to the adult one that they start presenting with the symptoms. So from there, the parents are advised to take care of the main things, which is dehydration. Like I mentioned, they have the risk of being dehydrated because their kidney do not filter water normally, like the normal kidney in other persons. Also, with this continuous breakdown of red blood cell, there is anemia. The anemia, iron is very important when it comes to making red blood cells in the bone marrow for the body. Also, so the iron in sickle cell patients, although the red blood cells are being broken down, the iron is not sent out. It is not lost. It is instead the other components which are used to make the red blood cells, like folic acid and vitamin B12. So these people, the children need to start being on folic acid, right? They have to take it almost all their life. They don't need iron because the iron is there. usually the folic acid, the bone marrow will fabricate the other one. They are just unfortunate that although the bone marrow is fabricating, the spleen is destroying them faster because they are mostly viewed as abnormal red blood cells. Then there is this new drug that recently came out, hydroxyurea, which helps some of the children to those who are sickler. It helps them to convert or to build more fetal hemoglobin. Since I said fetal hemoglobin has a capacity to carry more oxygen than the normal adult one, and these patients they lack even the normal. They don't have the good quantity of the normal hemoglobin.
Mm-hmm.
So this one is a kind of trying to create more of the fetal hemoglobin in them to help them carry more of this oxygen, which they are not able to do so with a normal human or adult hemoglobin.
Wonderful. Wonderful. So with a newborn, you mentioned they are prone to anemia. What about the mothers, the pregnant woman? Is she also prone to anemia during pregnancy?
Of course, she will be prone to that because the baby, the baby actually from a certain age, from the crossing the placenta, the baby absorbs some of the nutrients or the needs like this folic acid, right? The baby needs to absorb from the mother to make his or her own red blood cells. Though it's not using the bone marrow at that time, it's mostly using other organs. Then, as the baby is absorbing, the mother also needs, when you are pregnant or even when you plan to become pregnant, the advice is that you should start taking folic acid, iron, or start taking mostly iron, preparing to, because your body will need to build more red blood cells. The baby will need his own. So the baby actually absorbs some of those stuff and start making his own blood. So that blood start crossing when it's still very early from the zygotic stage until a certain age when the placenta is fully mature to start making their own things. Mm-hmm. So the mother is at risk of being more anemic. Even the normal woman when you're pregnant, if you're not taking blood medicine, you can be anemic. One more of a sickler.
Yeah.
So they are more risks as well.
Wonderful. And what about miscarriage? Are pregnant women who are who have the sickle cell disease, are they prone to miscarriages?
Of course, definitely. There's what we call retroplacental hematoma.
Okay.
This one is a kind of a small blood clot that collects between the placenta and the baby, the unborn baby, the fetus. So it is common in people, but it's not really frequent that way. I think the main thing is anemia. Miscarriage is common, but some people actually go through, you are well followed up, you are rehydrated. The main thing with them, you have to have enough water circulating in your body. All those risks are there. They are more in those sickle cell patients than in those who are
not
the sickle cell trait carriers and the normal persons.
Okay, wonderful. So, Dr. Hans, can you please take us through? Some people may have heard, oh, he's having a sickle cell crisis. She's having a sickle cell crisis. What shows that somebody is having a crisis? What are the physical signs and symptoms of a sickle cell crisis?
Okay, that's a good question. And the answer is very simple. It's just pain. If a sickler complains of pain, that one alone, we just tell me to classify it as a sickle cell crisis. It can be in any part of the body, it can be in the joints most often, the fingers, it can be on the level of the chest, what we call the acute chest syndrome, which is not as common as the ones they usually manifest in the joints.
Okay, the fingers.
So here in Africa,
you mentioned the fingers, where they usually feel the pain, the chest, the fingers.
All the joints in the body can be involved. The most common
Wonderful.
Yes, the most common being the fingers. And we also have what we call aseptic necrosis of the femoral head.
Wow.
That means the femur, which is the biggest bone in the body, between your waist and the lower limb. That's the joint. The joint joining the lower limb to the waist. They usually have, the blood vessels connecting the bones and the body. They have this potential risk of having a thrombosis or a crisis at that region, which may make blood not to circulate well at that level. And the femur, which is supposed to receive enough blood, doesn't receive it. So they have crisis at that region. It becomes aseptic and necrotized. So necrotizing is like tissue that are dying off.
Dying.
When they say tissue in the body is necrotic, it means it is dying off. So they have that risk. And when they develop that, there's a surgery that they do. Some people, they put an artificial substance on the level of that joint, right? To ease them move, because when that happens, each time you want to step the foot, it is pain. They cannot even move the foot. So actually it's quite frequent here in Africa. I don't know, maybe in developed countries the risk is becoming less likely because the precautions that have been taken and other things.
Yeah. Thank you very much for that.
Also, also there's something I wanted to add. There is this geographical distribution. There is one study that was done in the UK, and there is a tendency that some people in some specific regions have the risk of having a certain genotype, right? Like there's one that was involving Nigeria, Congo, Tanzania, and most regions in the world. So for our listeners, when they go ahead to do their own tests, you can be in a different country, but if you're coming from Ghana, Tanzania, whatever, there's a high risk. You can even Google it and see which one is at higher risk from your region. Right?
I didn't understand that.
Yeah, please go on. Don't mind Jeremy. Please go on.
I don't know. You can go to other questions if they are.
Yeah. So what's the name of the test that helps people find out their genotype when it comes to the sickle cell? These genotypes we are discussing.
Okay. All right. There are 3 main tests that have shown really good progress. Scientists are always working to see which one is best, which one will give us a final or a very conclusive diagnosis, less costly and most efficient. Now, the main thing that's very common is the hemoglobin electrophoresis.
HB electrophoresis, right. Okay.
We have high performance liquid chromatography.
Wonderful.
Then we have the genetic testing. Now, for this high performance liquid chromatography, this one can mostly be done in newborn, right?
That was going to be my next question. How soon can somebody get tested to know their genotype? So it's you are kind of answering all of that in this. Sorry for interrupting.
Okay, so actually immediately from birth, country like the US, they mostly do it from birth. They collect a sample from the heel. The heel is behind the leg, the last part behind our foot. Also,
yeah.
There's a bone there, the calcaneus. They collect a sample from the heel and they test from there the high performance liquid chromatography. I think it leaves better results, compared to the electrophoresis, though it is more costly and less available in Africa. Okay.
Okay.
For the genetic testing, it involves what we're mentioning. You take a sample from the amniotic fluid. You take a sample from or the placenta. We call it chorionic villus sampling. You know, the placenta has two parts. We have the chorion and the amnion, which contains the amniotic fluid.
Wonderful. Okay. So, can we move on to myths and advice? My first question there is: can prayer, can diet, or herbs change somebody's genotype?
Oh, that's a very good question because as Africans, we are actually having a tendency to believe that everything can be solved with prayers.
Yeah.
And it is really unfortunate.
Yeah.
I wish all the pastors who receive so many Christians, they could actually pass them this information. Just tell them, please, know your genotype, go and do it.
Yeah.
Yeah. So, I've been hearing stuff like there's traditional herbs which can cure hepatitis, can cure HIV, they can. So I just asked myself, why don't they just come to the hospital and cure everybody so that we can relax? Actually, I don't think it's true. Prayers, it's good to pray. Everyone have their belief. But when you really have a condition, or when you know about something, the best thing you can do for yourself is to look for a way. What can you do, right? And actually, the best part of medicine is preventive. Preventive medicine, prevention is always better than cure.
It's always better than cure, yeah.
Yeah, so when you try and know your status, when you know your situation, you try to see what can I do. I'm not against prayers, but saying that you can't say that, for example, you have hepatitis B, whatever. You're praying, you're not looking for what you can do. Later on, you start vomiting blood, you're having this. I don't think it will really help you. Okay, the same for all medical conditions. I don't know what has been cured by prayers, except you have been bewitched by something, you are possessed or what. Maybe prayers can intervene, but this, I have no idea.
Okay. So medically, no, prayers does not change people's genotype. It doesn't. But again, just as Dr. Hans is answering, yes, there is nothing God cannot do. But if your genotype is SS and your partners, you are not married yet, your partners is AS, you've gone to, that is why the Bible has said that God has given us the fruits of the trees for food, and then the leaves for medicine. He has given wisdom. So all these, chorionic villus tests, amniocentesis. I believe, I'm a Christian. I believe that all these developments come from God. So God is teaching us how to, manage all of these, how to prevent and all of that. But this is a myth. Genotype is genetic. Genotype is genetic. All right. So, what's your advice to young people about genotype and marriage?
Okay, like we mentioned, I think the aim of this life, bringing people together, is for them to be educated, to be aware of what they can do, not to find themselves in a situation where they'll be like, oh, had I know this is a trouble I was going to be having every day. So it is advisable to start with yourself, know your own genotype.
Know your own, yes.
You might not know your partner's own. Not everybody will want to do it. There's some people that they don't want to hear anything about checkup, whatever. People who are really conscious, right? People who are conscious, they know their state. It's advisable to even go for checkup every year in a hospital. For women who are sexually active, it's also advisable to do your cervical cancer screening test at least every year once you are sexually active, because there are medical conditions when they discover early, they can help you. Like for the cervical cancer screening, the breast, right? Breast cancer screening and all those stuff. Once they are discovered early, there's a situation that they can manage. But most of us Africans consult late.
Yeah.
Somebody wants to see that it's really getting worse before they are going to the
Before
hospital.
before they
For
are
most
running.
persons. And
Yeah.
when the cancer or something has reached a certain stage, there's nothing they can do. Only do palliative care, accompany you not to suffer too much, but it will be unfortunate. So, knowing yourself is the first thing. We all go out, we hustle, or you need to be in good health to hustle.
Yeah.
Right? So, know your genetic, your genotype. If possible, know the partner with whom you're hanging around with,
Very
because
important.
the child can commit at any moment.
Yeah. To avoid future regrets, as you've already said.
Yes, actually, it's very important. And to avoid the stress. Now, let me just, there is some information we used to convey. The sickle cell traits, like we said, the AS population, they are benign carrier, which they live normally, though the potential risks that we have mentioned, when they go to high altitude, if they are athletics, they can develop certain conditions.
Yeah.
So knowing all of that, or knowing your status, will make you to be aware of all of that. You cannot do this, you cannot do some kind of heavy exercise like you're running, or things that are dealing with competitive sports. You avoid them.
Yeah, so it's good. See, Lion Bai is asking this question. He says, what are the do's and don'ts of sickle cell patients?
Okay, for the do's, like we mentioned, they should always drink water. Every day they should drink at least 2 to 3 liters of water.
Keep themselves daily, well hydrated.
Because their hemoglobin or their red blood cells are not having a good shape. They have a tendency of blocking blood vessels. Normal red blood cells are spherical in shape and they are flexible when they reach smaller blood vessels. But for the sickle cell patients, they are not flexible. So when they reach a certain level, tiny blood vessels, they can block. They block that blood vessel and you have what we call ischemia. Ischemia means oxygen is not passing, that region is hypoxic. You can actually have necrosis. If it happens at the level of the brain, they can develop stroke. At the level of the heart, they can develop heart attack, to call it in common terms. And it mostly happens at the level of the joints. That is why they mostly present with joint pain as what people term crisis. Yeah. Because say crisis. Now, for the don'ts, one of the important things they should do, if let me just run over the do's, they should get vaccinated. All right. They should get vaccinated against encapsulated bacteria. We have streptococcus pneumoniae. And then other things, when you go to see the counselors, or just go to a hospital, if you're sick and say you want to know the vaccines that you should take as a sickler, they will direct you to the genetic counselor, they will do all the stuff and they will tell you what to do and the frequency at which you have to be vaccinated.
Wonderful.
Great. So we'll talk about rehydration, the vaccination now, the folic acid, which I've said, they need to be taking it daily. Usually we prescribe 5 milligrams, they take every day, so that the bone marrow will help to produce the red blood cells that have been broken down frequently. Right? Yeah. Then, what they should avoid, should not drink alcohol, we should not consume certain things that are toxic. Because things that are toxic, they will touch the liver, they will touch the kidney, and these things, they filter the body, right? They filter every waste. So if any of these organs, which are already at risk, if they are damaged, the patient will suffer even more. So if you're a sickler, your best friend should be water.
Wonderful. So when you say toxic substances, what are some of the toxic substances they should stay away from?
Toxicity, mostly start with alcohol. I don't know about other countries, but in my country, I know people like drinking a lot. There's alcohol, there's smoking. Then other substances that I might not know. So it's always good that when you reach a patient, always consult your doctor before you take anything. Especially over-the-counter drugs that people just buy drugs anywhere. It's not advisable.
Wonderful. So when Dr. Hans was answering the question for the immediate care to be given to newborns who are um, having the sickle cell disease, or parents who are sickle cell, who have the sickle cell disease, he mentioned about the heel prick test, right? And in some countries, he mentioned US does it, the UK as well does it. So I will add on that the newborn blood spot screening is one of the reasons why it is done, is to help figure out if the baby has got the sickle cell disease, and it's usually done by day 5 of the baby's life. Okay, so if you are from where myself and Dr. Hans is from, Africa, and you find yourself in the US or you find yourself in the UK, and then your midwife comes and she's like, I need to take blood sample. I'm going to prick your baby's heels to take blood. Please don't. Um, it's an informed decision. You can decline it anyway, but just know that this sickle cell disease is one of the reasons, one of the tests that that sample is going to help detect. So that early detection, Dr. Hans have said one of his main advice is that you need to know your genotype as early as possible. That is one of the ways that your baby can know his or her genotype as early as possible, so that if there is any immediate care they need, they can have it. All right. And as Dr. Hans has said, it's very, very important. If you don't know your genotype, after this live session, this is the time to go, your GP, go to your doctor, go to your hospital to find out, because early knowing it early is important, so that if you are a carrier or if you have the disease, because I believe there are people who have the sickle cell disease but they just don't know, because some people will not even, they keep getting the crisis, and some people will redirected to a spiritual, it's spiritual, and they will not even go to the hospital to find out exactly what it is. And unfortunately, life expectancy is reduced. So it's very important that you know your genotype, so that you can get appropriate medical management, medical treatment, and as well, you also know how to take care of yourself. And when it comes to choosing a life partner, if you know you are a carrier, you are AS or you are AC, you know how you are going to relate to people. It will help you make an informed choice in choosing a life partner. And even if you are choosing a life partner who is also a carrier or is a trait of the disease, you guys can go for early premarital counseling, or you can go for counseling before you start thinking about having you start having babies, so that you can take the steps based on the informed, you can have informed decisions moving forward. Love is important, but health and the future of your children matters too. So guys, it was really great having you here, and Dr. Hans, thank you so much for your time. If any of you have a question or you want to join the guest seat to contribute or ask a question, you are free to. You are free to do that. Those who has followed us, myself and my guest, those who have gifted us, those who were sharing the live, those who were tapping your screens, I really appreciate you all. I see what you're doing. Dr. Hans, please, you have any final words you want to add on to all that we've discussed today? You are muted. Okay.
No, we can also add that people who are sicklers or people who have sickle cell patients with them, you know that those people, they need a lot of psychological support. Okay. And also, when you're going to do a test, you should also have an idea, it's good to do the HB electrophoresis or the high performance chromatograph that we mentioned. There are actually some tests that have been proven to be less effective, like the one we call Sickle. If false positive, according to the reports that we have had, we have sickle prep, solubility testing. So it's good to do the electrophoresis and have the results. Also, the main thing, drink water, take the treatment for the children. It's good to look for this thing. Hydroxyurea is a kind of treatment that helps to build up the fetal hemoglobin in them, even though it will not be as much as that of a fetus, but it is still at a level that is helpful to them. But I thank you for
Dr. Hans
inviting me today.
Dr. Hans. I don't know, but I nearly missed this question I wanted to ask for the benefit of everybody who is here with us today. What's the life expectancy of sickle cell patients?
Yes, actually, before they don't used to live long, right?
Mm-hmm.
But now with the information and the improvement in healthcare, yes, at least there's great improvement.
Good.
So generally, it's less than 50 years. Okay. Though some miraculously go above that, but they don't live that long.
Yeah, because I've cared for a patient. I cared for a patient who was 72 years, and 3 years later, he was still around. So, as you said,
so like I said, there's a lot of improvement, especially in developed countries where there are a lot of things they already know. But in Africa, where people are unaware even of the situation, imagine you don't even know the thing, you don't even know what to do. So when they just discover you that you're already a sickler, it's different from when they discover right from birth and they start doing certain things.
Yeah.
And also the issue of vaccination is very important, because when you get vaccinated, there are some germs that you are prevented from, and it reduces the risk of being infected, so having infections all the time and being sick all the time, right? Which also affects the life expectancy.
Okay. And there is this myth, some people say that people who are plump can never be sickle cell patients. It's only slim people and those who are petite. When you look at them, they are petite. Can you please talk about that? That the sickle cell disease, that people's body type determine whether they are sickle cell patients or not?
Oh, that is horrible. It is true that most of the patients that we see, they are smaller in size, they don't grow that much. But you cannot just look at somebody physically and say, no, you cannot be a patient. There's some that have that nature. Let's say your family, you mostly have people that are having a lot of weight, they are bulky, like that. You look and say it cannot be possible. It's true that in most situations, they are smaller in size, they're like this, but you cannot look physically and conclude, right?
Yeah, because somebody may have, from this live session, they will go to the hospital to get their HB electrophoresis done to find out their genotypes and all of that. And maybe they are talking to somebody, their partners, and the partner will go like, "Can you please," asking them to go and check, and they'll go like, "Oh, when you look at me, do I look like somebody who is a sickle cell patient? Can't you see I'm fleshy, I'm plump?" No, there is no way. That is one of the reasons why I asked this question. It's your body type.
Yes, it's very important.
Yeah.
It's very important. Things that are already proven by science. We don't argue, right? So it's good. You might be less likely to be that sickler, but it is good what you go and do to confirm it. Yeah. Also, than just assume. And also when you're doing it, is most importantly for the sake of the children you're going to be having. You might not be a sickler, you might be a carrier of the gene, which you are going to transfer to your next generation.
So in a nutshell, think about your children. Think about them and not just yourself. Wonderful. Great. Thank you, Dr. Hans. Guys, Dr. Hans, as he's already introduced himself, he's a general practitioner, a medical doctor currently practicing in Cameroon. It's Cameroon, right, Dr. Hans?
Yeah, actually.
Wonderful. And that's his TikTok handle. Um, so please click on it. And if you have any questions about this topic, the topic we've just discussed, I believe Dr. Hans won't mind, answering, giving answers to your queries. Do well to check his page and do well to click on his page to also follow him. Lion Bar is asking Dr. Hans, he's saying, what's the best blood tonic for sickle cell patients? I was just about rounding up.
You know, there are many blood tonics available. Each countries, they have different stuff, so I can't really tell. Here what we have, there is one that comes from France, we call Hemafair. It is liquid, and there are also tablets. Always advisable to be taking the tablets. There is this Hemafair. Is it Fair4? It's mostly folic acid.
Folic
you don't
acid.
even need iron inside because some combine. There are some blood tonics which combine both folic acid and iron, which pregnant women take. But for sicklers, it's advisable to take only the folic acid.
That's what I was going to say.
Since it's something that they'll be taking for a long time, it's good to go for the one that will be cheaper, right? The fact is that they do the same work. It's not because if you hear cheaper does not mean it's less efficient or less effective. No. Yeah. It's just folic acid that when it enters your body, the body will use it the way
that's what it does. You just need to have the right dosage. Okay. So folic acid. Wonderful. So as I was saying, please do well to check out Dr. Hans' handle. If you're on YouTube, you can, if you want to get in touch with Dr. Hans, you can pop it in the comment section of the live or the replay, and I can signpost you to him. It was great having you all here. Dr. Hans, God bless you. Thank you so much for sharing your Sunday with us. Um, those who also just joined in. If you joined in late, don't worry. As usual, the replay is going to be available on Josephine Greatness TV. That's my YouTube channel. So if you want to watch the replay and you need my YouTube channel link, go onto my TikTok bio. My YouTube channel link is there. Click on it, it will take you in there. You'll find the replay of this live session in the playlist titled Health Education, or you can go to the live session portfolio of my YouTube channel. You'll find it there. All right, guys. So go on there and watch it. It will help you. If you have anybody who you think will benefit from this live session, do well to share the replay with them. Right after this live session, the replay is going to be available on my YouTube channel. Please share it with them. Let them watch it. Okay. And if you haven't yet followed this page, please do well to click on the plus sign to follow. There is a lot here for you. There is a lot. I'm sure you can see it already. So watch out for content on. I'm going to be here with a midwife to talk about the midwives' process to relocating to Canada to practice in their healthcare profession. Last week I was here with a adult nurse who is currently practicing in Canada, and somebody asked if we could get a midwife because the midwifery route is a bit it's quite different from how adult nurses route is. So I'm still looking at the best time to come on here to discuss that with you guys. All right. We'll be here with, to talk about how you can go to Malta as well, how teachers can relocate to, there are a lot in the pipeline. And on the, Dr. Hans, thank you so, so much for your time. Once again, I can see you are still around. God bless you. Um, this is the second Your Midwife live session we've had. And the next on the line, some of the things that are in the pipeline coming is we are going to be here to discuss with a colleague midwife to discuss ectopic pregnancy, with a healthcare professional to discuss, what determines the sex of your baby. That's whether you are going to have a girl or a boy. What determines all of that? We are going to be here. And your midwife series, before that, let me just wrap it up here on. I was just going to say, let me wrap it up, but it's important those on YouTube also hear this. So, the Your Midwife series, we started the season one, which we've talked about pregnancy overview, talked about what pregnancy, what at all is pregnancy? What does it mean? We've gone through all of that. We've looked at types of pregnancy. We've looked at classifications of pregnancy. And now we've moved on to season two, where we are going to dive into high risk pregnancy. So that has started. So please watch out on my page on TikTok. If you are on YouTube, when you go onto TikTok, my TikTok handle name is, the username is Your Midwife, and then the handle itself is Josephine Greatness, just as you see my YouTube channel name, Josephine Greatness. All right, and find the all the information about pregnancy overview is all on my page on TikTok. So on TikTok, you can find the Your Midwife series videos in the playlist titled Your Midwife series. All right, and let's educate one another. All right, and now the season two is about high risk pregnancy. We are going to be discussing, diving into high risk pregnancy. All right. It was really great having you all here. So if you joined in late on YouTube, don't worry. It is still Josephine Greatness on Josephine Greatness TV. And the replay will be available on this same channel. So you can watch it from beginning. And I would say share it, share the live, share the replay with people. It will definitely help. And I believe this session has helped quite a lot of people. Those of you who joined in, I believe it has helped because I can see the uploads in the comment section. God bless you all for joining in. And I wish you a fruitful week ahead. If you haven't subscribe to my YouTube channel, please make sure you are subscribing. Those on TikTok, if you missed any of the live sessions, be it how to relocate to all the countries that I've been here to discuss: Finland, Luxembourg, USA, Canada, Australia, Finland, Norway, New Zealand, please know that the live replays are available on my YouTube channel. Okay, so please go on there to make yourself comfortable. Just watch the videos and you get a step by step guide. If you have further questions, you can come back and ask. All right. Um, yeah. And I'm not going to leave here without talking about my debut single. The title is In This Place. So, and it's available on all digital platforms and social media handles. That means that it is also available on YouTube, is available on TikTok, on Facebook, on Instagram, on all social media handles. You can use it as your background music. Please use it. There are free downloads out there. Make sure you are getting your free download. The title is In This Place by Josephine Benson. All right. You are going to be blessed with the track because it blesses me every time I play it myself. It's a great gift God has given unto us. And watch out for the second single is in the pipeline. It's going to be coming out. God bless you all. I really appreciate you all staying around. If you just joined in and you have any question about the topic, genotype, sickle cell, and marriage, you can send a DM or the short video I recorded and posted on my YouTube, my TikTok page. You can pop your question in the comment section there, or as well you can DM. If you haven't yet um, joined my Telegram page, I get some of you asking for my contact details. I don't share my contact details on social media. The best way you can get in touch with me is through the Telegram page. All right. So if you want to have conversation outside social media, that is TikTok or YouTube, please do well to join my Telegram page and channel. And if for any reason you want to be DM'd, just put on the page, can you please DM me and I'm happy to DM, all right, on Telegram. It was great having you. The Telegram page links is a Telegram channel and a page. The links are all in the description section of my YouTube videos. So please click on them and join. There are pages to support you in your relocation process. There are interview support pages, OSCE support, um, CBT support, IELTS support, OET support pages. So you need to join the page if you need any of these support. I can't mention all the support pages there, but then there is support for you if you are an internationally educated nurse or midwife needing support. So do well to join the Telegram page and channel. God bless you all. God bless you. I'm going to end it on YouTube now. It was great having you here. Take care.